Why does Suboxone sometimes cause sweating? Before we answer that question, let me take a step back and say many opioids, not just Suboxone and buprenorphine, are associated with sweating. I just want to avoid someone thinking, I shouldn't try Suboxone treatment because it's going to cause uncontrollable sweating. Because it's not just Suboxone. Many other opioids have been implicated in causing the sweats. On top of that, there are good ways to manage sweating caused by Suboxone. But going back to the original question, yes, there are cases of Suboxone, aka buprenorphine, causing sweating. The medical term for this is hyperhidrosis. It's not clear why Suboxone and buprenorphine cause sweating. In terms of prevalence or frequency, one study done in Germany surveying physicians about adverse drug reactions showed that 9% of physicians prescribing buprenorphine observed sweating, compared to 32% of physicians reporting sweating with their methadone patients. In my personal experience, I'd have to agree. Sweating or hyperhidrosis seems to be less common in buprenorphine patients compared to methadone patients. In the clinical trials done for Suboxone, sweating was reported in 14% of Suboxone patients and 13% of Subutex patients, compared to 10% in placebo. The clinical trial also saw no difference in sweating based on the Suboxone dose, meaning whether someone's Suboxone dose was on the low end or high end, which is like 2 milligrams to 24 milligrams, consistently 11 to 13% of patients reported sweating. That means for every 9 patients on Suboxone, 1 will likely experience sweating. And it's also important to distinguish between sweating caused by opioid withdrawal versus sweating caused by Suboxone. Is the sweating simply related to opioids or Suboxone wearing off in the body? Are you having the classic opioid withdrawal symptoms on top of the sweating, like sneezing, yawning, eyes tearing, nausea, vomiting, aches and pains, insomnia, restlessness? There's also a lot of other possible causes of sweating, even if you're on Suboxone. Thyroid issues, menopause, other hormone or endocrine issues, infections, and other medications or substances and drugs. And just a disclaimer, if you're also having fevers, chills, weight loss, fatigue, swollen lymph nodes, cough, shortness of breath, muscle ache, sore throat, and your sweating doesn't seem like it's related to opioid withdrawal, please get evaluated by a healthcare professional for other possible causes of the sweating.